This is the picture of the hemorrhagic necrosis of the intestine, also called hemorrhagic infarction. Here we have the partially preserved mucosa, and this is the affected necrotic part. Intestinal necrosis is always hemorrhagic because we have a lot of blood vessels in the small intestine and colon. Mucosa is the most susceptible to ischemic injury, so the inflammation and ischemia usually starts there. But when the ischemia is severe, then the whole thickness of the intestine can be affected, and the intestine is then susceptible to rupture. Morphologically, we can find necrosis with hemorrhage, with acute inflammation composed mostly of neutrophils. On the surface, there is a fibrinous exudate. The wall of the intestine is typically edematous, and also macroscopically, the infarction looks like edematous dark red area of the intestine. Ischemic damage can be associated with occlusion of the mesenteric arteries or veins, and it can also be associated with general hypoperfusion in case of shock. Anatomy is quite important regarding the localization of the ischemia. So in case of the occlusion of the celiac trunk, the ischemia can be seen in esophagus, stomach, and proximal duodenum, superior mesenteric artery. Occlusion can affect distal duodenum, jejunum, ileum, and part of the colon from the cecum to the splenic flexure, and the rest of the colon is supplied by inferior mesenteric artery. Small intestine is more susceptible to ischemic injury than colon because of the presence of collaterals in the blood supply, and in the colon, the most susceptible area is the splenic flexure. Alright, thanks for watching.